afternoon. I'm glad to be here with you. I am here talking about some of the most favorite work that I've done in my career. So let's get to it as we go forward. Basically, these are medical offices that are put in schools across the state of Louisiana. There are 63 sites in 26 different parishes. We serve and have visits of students, about 135,000 of them annually. 96% of the time, we send these students back to class, which also means that they are not missing school, so they can stay in school and learn. The sites are located in rural and urban sites. In some of our sites, stay open year-round because they're the only provider in the state. Historically, so that you understand where we came from, this was not a pie in the sky, let's just do this. Robert Wood Johnson Foundation, the largest health foundation in the country, looked at 1 billion office visits of all kinds of providers. And what they saw was that the lowest served population in our country are the adolescents. The perception is they are healthy, but what we know now from studying them is they are practicing very high-risk behaviors that cause major problems in their lives as they get to their 40s and 50s. So we had the funding, the original funding that tested the pilot, if you will, was done in 25 communities across the United States. There was one in New Orleans, and the provider, who was a physician at LSU Medical Center, decided he was going to take the money meant for one health center, and he opened 2. After this 5-year study, we demonstrated the effectiveness of putting medical and mental health providers in schools. And I want to pause right there because that is a very important statement. To my knowledge, we are the only provider type that has both medical and mental health staff in the same location. So when our medical providers have to make a referral to mental health, there is no 3-week or 4-week wait. They go immediately next door to the next office, and the child is seen very quickly. So in terms of how we get to this integrated primary care and mental health model, it's really not rocket science. Our staff, all of us have a medical director, a physician that could be a pediatrician, a family practice physician, even an internal medicine doc. We all have medical directors, but we also have physicians that go into the sites, Allen School campuses, and provide service every day. The backbone of our model are nurse practitioners. Those are the people who really see the bulk of the students medically that we're working with. We also have nurses, be they registered nurses or licensed practical nurses. And again, the most important part that we bring to the table from my experience is that we have either licensed clinical social workers or licensed professional counselors that are on site working side by side with those physicians, those nurse practitioners, and those registered nurses. What we do is, and most of these things are part of what our national organization calls the core of prevention. We do a lot of what our physicians call well child checks or physical exams because many of these students have no other provider. We are it. We also do something called a risk assessment where we're looking at behavior because remember what I said earlier, their behavior is what's getting them into situations where they're ill and not doing well. We screen for clinical depression. I don't know if you all know this, but suicide is a very high cause of death for teenagers in our state. We screen for chlamydia, which is a sexually transmitted disease, And we also look at body mass index. What that is we're looking for kids that are at risk of obesity, because part of our challenge is that we have a lot of students that are obese. They already have high blood pressure. Many of them become diabetics, and they become a lot of work for our healthcare system. We also, because on any school campus, I don't care what state you're in this country, the highest number of chronic disease patients on any campus is going to be asthma. It tops everything else and always has. So again, when we look at what we do, we have risk assessment, we making referrals to the medical team, we make referrals to the mental health team, and we have the mental health providers sitting on campus serving children so that they do not have to wait 3 weeks to get to another provider. One story that I have that I think drives home this issue of suicide and suicide ideation. One of our sites, which is in the southern part of the state of Louisiana, in 2016-17, they did 172 assessments for students that might be at risk of suicide. They had 8 students that were hospitalized because they were very serious about their comments about committing suicide. I say to all of you in this audience, be you grandparents, parents, or you have next door neighbors, if you hear somebody think about or verbalize that they're going to commit suicide, they need to be seen by an expert provider, because you don't want to take the chance that they really are going to commit suicide. This is data from health centers and schools, so I know it well, because I've always been very interested in the impact of mental health providers on the wellness of the child, but also on what's happening with the academics, because we know that this is a challenge for some of our students in school. This is data that went from 2009 all the way to 2013, and what we're showing you here, these are only students that went into mental health therapy with either an LPC or an LCSW. But what we're showing you is those students' grades improved because we were there helping them overcome whatever that challenge was, and we were able to keep them in school. We also do a lot of things that are considered population health. What that means is, instead of just looking at a slice of people, you kind of look at a whole campus of children and adolescents. Or in some cases, like us in Baton Rouge, we look at the whole school system because we also are the school nurses. Vision and hearing are the things that we do that are most directly related to education. Because if you can't see, you are going to have a hard time learning how to read. Reading is the key to education, by the way. And if you can't hear, you're not going to hear the way the letters sound, so you won't speak correctly. Oral health, standing before you, as an adolescent medicine person, I'm here to tell you this is something that I can make a claim and know that I'm on solid ground. If we look at what's happening to the children of this state, by far and away, oral health is the most neglected service that most of these children have. There simply are not enough dentists. And when they may have a concentration of dentists, as we do in South Baton Rouge for this city, I can tell you, to my knowledge, there are only 3 dental providers in North Baton Rouge. So it's very hard to find oral health services. Another thing that we are into in Baton Rouge, and I had to put it in because it is a population health initiative, a company several years ago created a vaccine for flu that's inhaled. It's not an injection. You literally inhale it. That vaccine was taken off of the market by a committee on immunization practices because they didn't think it was a good enough vaccine. Well, guess what? It's back. 2018, flu mist is back. We will go back to immunizing thousands of children for flu at school. I suspect because of how rough this past flu season has been, we're going to have quite the turnout and permission from parents to immunize their students at school. Asthma is the #1 disease in any school. I've said that. We have a school asthma management program, and we really are looking at how do we keep them in school. What that means is we run a test called an asthma control test, and we determine whether they are well controlled or not well controlled. All not well controlled students, we call their parents and we call their provider, because we don't want them having a problem with this disease at school. We want them to fall into that well controlled category. We have a lot of strategic partnerships. We could not do what we do without the help of these kinds of agencies in any community, be it hospitals, dental programs, vaccines for children, which is how we get the bulk of our vaccine for the children that we see, because most of our students are insured through Medicaid, and food banks. Some of you might say to me, why in the world would you do food banks? Well, we have a great partnership here in Louisiana, in Baton Rouge, with the Greater Baton Rouge Food Bank. Mike and I work very closely together. Why do we have this partnership? It's because there are 25% of the children of the state of Louisiana that go to bed hungry at night. So I can tell you from personal experience of being and even in a more affluent parish that this is the truth. I remember a school lunchroom manager who showed up at the school where I taught at the same time I did, and I got there really early because I'm a medical person by training. I said, "What are you doing here? It's 6:30 in the morning." She said, "You see those kids sitting over there?" I said, "Yeah." She said, "The last time they ate was Friday at noon when they were at school, and this was on a Monday morning." So it's a real challenge about how we conquer this issue of food insecurity. I want to stop right here because I've given you a lot of facts about what we do for children and for youth across the state of Louisiana. But there are some other things that we are doing that are also equally beneficial. We are training the future providers of health care in this new way of looking at how you might want to think about schools, that they're a place where health can be also be given. We're training residents. We train in Baton Rouge pediatric residents, family practice residents, and also psychiatric residents. Nurse practitioners, both family nurse practitioners and pediatric nurse practitioners. I might also add to that, we are now beginning to train physician's assistants. We train medical assistants who are the support staff to many of the physicians across the state of Louisiana and to us too. And then we are heavily involved in training social workers, licensed clinical social workers from LSU, as are some of our sites training also students that will become a licensed professional counselor. So, this is a study that comes from, again, health centers and schools. What we have calculated, if a child has to visit a physician outside of a school-based setting, they will lose, if not a whole day, at least up to 6 hours of instructional time. We looked at how many academic hours would be lost if we had a little over 22,000 visits in our school-based health centers, and that was about 135,000 academic hours. What we are doing is keeping kids healthy so they can stay in school and learn. And we know that that is what needs to happen for them. Again, I go back to, we only have 3 ways of moving a student out of a school. They either go back to class, they go home with their parents, or we EMS them if they're in a very critical condition. So I can tell you that this is helping both the education system and the health system. This is where our funding comes from. By large and away, we are in a dedicated fund called the Louisiana Fund, and we have another pot of money that's in a Medicaid LINCA, which is an agreement between the state, the federal government, and that draws down a high percentage of federal dollars. We also have some dedicated federal dollars, and we have state general fund dollars. So we are very concerned about our LINCA funds, because that is a place where that makes us whole and gives us the ability to maintain the sites that are across the state of Louisiana. So, in closing, can't wait for your questions. We know we have demonstrated results. We have proven that over and over and over again, as have sites across the country. We are improving the access to care, which this is all about. This is not about anything but access. Adolescents never had access, and when you take away school-based health centers where they are in school, they're going to go right back to not having access. We know that we increase school attendance because we keep kids at school. We're also reducing the cost to health systems from very high emergency room cost and from urgent care visits. We are managing the chronic disease that comes to school. And for most of the people in this room, I think that's the big game changer. We have thousands of asthmatics on school campuses. We have about 100 diabetics on school campuses. And the amount of chronic disease that we are working with, students with chronic disease, is pretty big. And this is affordable and accessible care for the student, because we're in the one place they have to be in this state, and that's at school. And we're also, by the way, just so you know, keeping their parents at work too, because they are out working, earning a living for their children. So if you need more information, I've given you 2 websites here, and I'm certainly willing to entertain any questions that you might have. Yes, sir.
So are you in all public schools? And if so, logistically, how do you apply it within a school? Do you have a person who works for the Alliance, or is it through the counseling department?
So the question is, are we in all public schools, and how does this work when you are dealing with lots of kids in public schools? Unfortunately, we are not in all public schools. I wish we were. What we are doing is opening up our doors to students that are on other campuses. In one rural parish, because it's the only provider type in the parish, basically they run a little school bus route, and they bring students from all of the schools in this parish except for one school, because it's way away. And so we are providing access to greater than the students that are on our campuses in a variety of different ways. Personally, I would love to see us double the number of school-based health centers, because we would do, I think, a great job. Yes, sir.
As a grandfather who's been away from schools for a very long time,
Yes, sir.
back up and help you a little bit. Basically, Baton Rouge must have 25, 30, 40, 50 schools.
Actually, we have 90 schools.
90 schools.
Yes.
Does each of these schools have a practitioner, nurse, or something? I mean, I'm kind of mixed up basically.
Yeah.
What does schools have, and what do you add over and above the base of the schools have?
In most school settings, there's a registered nurse or a licensed practical nurse that is serving a school. In most of the schools in the state of Louisiana, those people are rotating. They're not on any one campus all day long. In a school-based health center, we have a group of people that are there all day long. So the difference between when I went to school is that I may have seen Ms. Delcourt, who worked for the public health unit in West Feliciana Parish, and she would come to school every now and then. We didn't really have any schools, any nurses in West Feliciana Parish. They called our parents and we had to go home. That's how we solved the problem. In urban parishes, there are school nurses. We also run the school nurse program here in East Baton Rouge Parish. That model exists in other places. But there are school nurses in Louisiana besides the school-based health centers. Yes, sir.
With 90 schools and 7 in East Baton Rouge Parish diagram, why don't you float your center from school to school?
So the question is, why don't we float the center from school to school? We are doing the same thing that physicians do in their offices. And so we have exam tables, we have certain kinds of medical equipment. It literally looks like a doctor's office. And so it is the bricks and mortar of a doctor's office that gets placed on a school campus. There's no way I can load up all the equipment and take it somewhere else and provide the kind of services that we are providing, because we are giving access for primary preventive care to the students on the campuses where we are housed. And we will also see students whose parents will bring them to that site for the same reason. Yes, sir?
In the past, haven't they taken something like an RV or a bus and converted it?
Well, it's funny that you should bring that up. I'll talk about Baton Rouge. In 2016, Glen Oaks High School was flooded, and we had a school-based health center there. We have been providing services thanks to Our Lady of the Lake Regional Medical Center with a big bus, and that has been how we have providing those services. It is very difficult to put a driver and 3 providers on those buses, but we are making it work. We also, in Baton Rouge, have the luxury of the Children's Health Project, which are mobile units. They only can move to 10 schools, though. It's 10 additional schools where we don't have school-based health centers. So that is one way you might want to think about it. There are some pretty large costs associated with it. You still have the same providers, but now you've got to maintain the bus, and that is not an inexpensive way to go. Yes, ma'am.
Are you doing sports, physicals?
I want to say is my name Sue Catchings, because the answer to that is yes. We start working with the coaches before school is out. And then when we bring back a team of providers on July the 5th, if that's not on a weekend. And from then until we get into our training sessions, we are doing sports physicals for lots of kids. And that continues throughout the entire first semester, because we will do high school sports physicals. That's a lot of stuff that we do. But the middle school, we don't even know who the 6th graders are going to be at the school. So who are they going to be on a team? So we maybe could do the 7th and 8th graders, but we don't have no idea who the 6th graders incoming are going to be. But it's a big part of what we do. I might also add that we choose to bump those up to a comprehensive physical exam if the child hasn't had one, because that's very important. Yes, sir?
Can I go back to the Baton Rouge example? We have 90 schools.
Yes.
How many of those schools have a registered nurse?
They all, except for the sites where the school-based health centers are, they all have a rotating nurse, which may or may not be on their campus. Because what we have to take care of, our first charge, is to take care of the students with chronic disease. So these are rough numbers, but I'm going to give them to you anyway. I know that there are about 100 diabetics on East Baton Rouge Parish campuses, and they're spread out probably over 25 different schools. They get insulin one or more times a day. I think we give insulin about 121 times each day. That has to be done. Then we have the asthmatics. There are roughly 1,800 of them in East Baton Rouge Parish Public School System. I know that about 500 of them have medication and doctor's orders at school, which means they're the ones we monitor. There are also about 400 students with seizure disorder. There are about 5 or 6 hemophiliacs, which are kids that we worry about because if they get hit, they could bleed to death. We have a group of students that we don't do too much with because we've stopped giving Ritalin for ADHD, but that's about 1,200 students that have ADHD. So it's a orders of magnitude, and not only that, it's where are you? Because we have to move the resources to where you are. Yes, sir?
Some of us, a couple of us were wondering, and maybe you covered this, I apologize, I haven't jumped up and down a couple of times while you're speaking, but the Louisiana Fund for your funding, what is that?
The Louisiana Fund, let me look at my little, I'm looking at the same thing you are. The Louisiana Fund is a statutorily protected amount of money that was created probably in the late 90s. And those, it's not just school-based health centers. There's a lot of stuff in there, but it's all statutorily protected.
Is that out of the tobacco settlement?
It is out of the tobacco settlement, yes.
Started telling me, I thought
Thank you for reminding me of that. Yes, ma'am.
Do any of the school districts provide funding for you or?
So the question is, do any of the school districts provide funding? Yes, they do. School districts, if they have a school-based health center, they have to renovate the space. They have to pay for the phone lines, the utilities, and the heating and the air conditioning. We usually take up about 1,500 square feet of space and usually have 2 exam rooms and a couple of offices. That's their in for what they have to provide to the school-based health center. They are our partner, and there's always that cost associated with what we're doing. And I also want to make sure I'm clear. There are some school systems in parishes who have made up their mind they are going to be the provider of services, and they receive the contracts that a medical provider usually gets. So schools themselves. I live in West Feliciana Parish. West Feliciana Parish School System has a school-based health center. It is run by West Feliciana Parish, but it has medical directors from the community that come in and work with them. Make sense?
What is your relationship with the Department of Health?
The Department of Health is where the contracts that support the current school-based health centers come from. So that's through the Adolescent and School Health Office, which is part of the Bureau of Family Services. So we have been in that mode now since almost the ending of the Robert Wood Johnson Foundation. We've had support from the state. Yes?
What happens to school-based health centers when you've got the budget shortfalls that we saw last year and that we're seeing this year, since your funds come through DHH? I mean, how do you get your money, or do you get your money?
So the question is, what happens in a budget shortfall where some of the funds have been cut? I would tell you that what we spend our contract dollars on are staff. It's the people who are providing the service. It's the family, the nurse practitioners, those social workers, or licensed professional counselors. We lose that, we're going to lose some of our effectiveness of being able to care for students across the continuum. Right now, we're at a bare bones model. There's none of us that are operating with just a whole lot of people running around. We don't have that kind of model. It is a bare bones model, but because we have a team sitting on a campus, we are able to effectively serve the students on that campus. Yes, sir.
As president of a national organization, are there any states that fully implement this concept throughout all of their schools?
I'm not as familiar, that's a great question. It's about, are there any states that fully fund this model? I can tell you that the state of California, Oregon, New York, and then states in the Northeast, Michigan, Illinois, those states are highly involved in this and are moving into this world because it makes sense. It's a cost-effective model. It happens at school. You get to kids that you would never see in a doctor's office. So those are the reasons why you would go down this road, is you've got populations of people that literally can't get from one side of your town or city to the other. Yes?
So, is the diabetes type 2 in children escalating?
The question is diabetes type 2, is it an ethnic problem? Diabetes, escalating, I'm sorry, I didn't hear that. Is it escalating? Absolutely. Here's the data. I'm a data geek. When we took over the school nurse program, which gave us the venue of looking at all 90 campuses, there were 35 diabetics. This was in the year 1994. 35 diabetics, none of them took insulin at school. This year we're handling about 100 diabetics, and most of them are on insulin one or more times a day. This is going to be the disease, in my opinion, that literally is going to have huge impacts on our entire healthcare system if we don't get this under control. And this goes back to, in this city, I can tell you, there's not one grocery store there's only one grocery store that I can think of north of Florida Boulevard. There are no places for people to get fresh fruits and vegetables, so they're eating food that's high in fat, high in salt, and high in sugar. This has been created because we truly don't have enough grocery stores.